My name is Greg Jager. I am 51 years old and I was diagnosed with prostate cancer. And it actually started probably 20 years ago with my father getting prostate cancer. Every time I would go in for a physical, I would tell my doctors of that history and they would do a PSA, and this was from the time I was in my 30s. And then in the last year, back in April, I went in for my regular physical and my PSA was up to 2.6. Through that point, my brother called me and said he was diagnosed with prostate cancer. And that was a big trigger point for me. My father had it, my PSA is going up. So then I immediately went back and had another check, went in and got the biopsy, came back as cancer, and that was about in December.
Greg was at higher than average risk for prostate cancer. Why? He had a fairly strong family history of prostate cancer in his male relatives. And when we see that history, we actually interpret and monitor PSA levels much more carefully than we do for a man who is of average risk for prostate cancer.
I couldn't believe it at first. I got 2 little kids. I was young in my mind. I felt young. I didn't feel sick. It was extremely important for me to be active and involved, just generally, with my children, with coaching, socially, and with my work. I immediately knew where I wanted to go. I've known about Siteman Cancer Center. I know about NCI designation. I know what that means. So the only choice in my mind was to go to the best people I knew.
Like many men who've been healthy most of their life, Greg was quite concerned about the prostate cancer. The concerns being, gee, can I be cured of the prostate cancer? And if so, at what price? In terms of side effects related to urination and sexual function and whatnot.
My biggest concerns going into this, number 1 was survival, and number 2, sexual performance. I had some pretty good contacts and asked them, who should I see? And they immediately referred me to Dr. Andriole, who is world-renowned in the research and the procedures and treatment for prostate cancer.
What Greg chose to do is, after his biopsy, to get a MRI scan of the prostate. And this is a new technology. We're using a stronger magnet than most of the MR scanners that are available. This is a 3 Tesla magnet. You need special software to analyze the images as they come out. And what we've been learning over the last few years with this is that it tells the surgeon exactly where the cancer is located, and that information is critical for the conduct of the surgery. And with that approach, we're able to maximize the chances that he will have a good functional outcome and not compromise whether or not the surgery in fact cures the cancer.
The advantage to having this world-class care in West County, it was a 10-minute car ride. I was in my neighborhood basically. I felt very comfortable.
The good news for the St. Louis community is that the same expertise that's known to be available at the Kings Highway location is now also available at the campus of Barnes-Jewish West County Hospital.
The biggest thing I would tell any person who has a fear or an anxiety about having your prostate examined is it's not that bad. If you have a history, you have to do it. Had I waited, and not done it or have some sort of stigma about getting an exam, who knows what stage it could have been in, and who knows if I'd be here. My experience with the Siteman Cancer Center has been nothing but humbling. They're all experts. They all know what they're doing. And they saved my life.